My name is Dr. Raveendran. I'm a consultant orthopedic surgeon and sports medicine surgeon based in Ipoh, Malaysia. I have been in practice for many years, more than 30 years, mainly based in private practice. And I've also been very much involved in international orthopedic teaching, work, examining students all over the world. And I'm one of the most senior orthopedic surgeons in Malaysia. Shock waves are basically acoustic waves, like ultrasonic waves. And they have been in use actually now for more than 20 years. They were initially used and are still being used for the blasting of renal calculi, ureteric calculi, and bladder calculi. And they use the lithotripsy machines for that purpose. But our shockwave is not for blasting anything. We're not trying to destroy anything. We're doing the exact opposite. We're trying to bring about regeneration, neurovascularization, and healing of the inflamed or injured tissues. And we have used shockwave for multiple purposes, mainly for three, that is tendinopathies, for bone pathologies, and skin pathologies. But shockwave has been used in many other fields of medicine, like cardiac surgery, neuro, for erectile dysfunction, and so on. But today I will stick myself to the orthopedic indications for shockwave therapy. So I would just like to start by showing this book, which you can see. In this book, I've written a chapter on shockwave therapy, and if you want to, you can look for this book and for the chapter. This is a chapter, shockwave therapy, and most of what I say will be in this chapter. This book was just published last year by Springer, and I've also got another chapter in another book coming out this year. So let's start with shockwave therapy. There are basically two kinds of shockwave therapy. One, what we call shockwave, that is the focused shockwave. These are the, to put it simply, these are the more powerful shockwaves. And the treatment per se is very painful. And you may have to give some form of analgesic treatment, sedation, or sometimes you may need general anesthesia for the bone treatment. The other kind of shockwave is what we call pulse waves, that is a radial pulse waves. These are not focused shock waves, and these are still painful, but they are not so painful. So that basically the two different therapies. One is focused shock wave, one is radial pulse waves. The focused shock waves therapy is normally done by medical people, that is doctors, orthopedic surgeons, physical rehab doctors, family doctors, and so on. Any doctor who is trained, who has been certified to do shockwave therapy, can do shockwave. You don't need to be an orthopedic surgeon. The radial shock pressure wave is generally done by physiotherapists, by sports medicine doctors or sports medicine physiotherapists, and so on. And one big difference between them is a focused shock wave, you just need to give 1 or 2 or 3 sessions, while the radial pressure wave is more a physiotherapy tool and it's got to be done frequently over a few weeks, 2 or 3 sessions a week for a few weeks, almost similar to other physiotherapy machines or other treatment. There are many physiotherapy treatments that you can do nowadays. So coming back to shockwave, there is more the focused shockwave. We have been using it for the last 20 years, and every year there have been improvements, new studies, and so on. So we are completely certified by the FDA, and Shockwave is certified to be used in America for certain of the conditions. And we have got lots of studies, both basic research and also a lot of clinical studies, both prospective studies, randomized studies, and retrospective studies. I would say a few thousand papers on shockwave therapy in the literature. Shockwave therapy is very popular in many parts of the world. Number one will be Europe, very popular in Germany, Austria, France, Italy, Spain. So it's very popular in those central European countries. Not so popular in the United Kingdom, but it is still being used. Number two will be South America. It's very popular in South America. Most of the countries in South America have a lot of people using shockwave therapy, and they also have their own associations and their own certification and training and so on. The next big group will be in China. So it's getting very popular in China. And of course, China, they have their own, they manufacture and produce their own machines, and so it's very, very popular there now. We had a last meeting in China. Korea also popular, and Japan is popular. Unfortunately, not so popular in Malaysia, although there are many doctors using, but we do not yet have a national organization for shockwave. And it is not so popular in India. So, and of course, in Africa, it is not so popular. In the Middle East, some countries using shockwave. So basically, it's an international, it's used internationally. And the two top places would be Europe and South America. If you look at the indications, which are all listed in the website under the ISMST, that is the International Society for Muscular Shockwave Therapy, and we have given all these indications into four different groups. We're looking at the approved standard indications. There are three big groups. There is a chronic tendinopathies, the bone pathologies, and the skin pathologies. So let's start with the chronic tendinopathies, which is the most common and the most well-known. Number one is calcifying tendinopathy of the shoulder. That means you get shoulder pain, severe shoulder pain with limitation of movement, and we do an X-ray and show some calcification in the shoulder. And for this treatment, good treatment is shockwave. Sometimes even with just one treatment, you can get an immediate relief of the pain. The next one is tennis elbow. Again, very common problem among the population, tennis elbow. And this also is approved standard indication for shockwave therapy, the focused shockwave. When we talk about focused shockwave, you don't have the focused shockwave machine. You can still use the radial pressure wave. That means you can also use it is interchangeable. Of course, the number of treatments and all that, there are protocols for it, and you have to learn how to use it. The next indication, there's basically the 6 indications for tendinopathies. The next one is plantar fasciitis. Very, very common heel pain with a spur. It's very common. Patients know about spurs, calcaneal spurs, with or without spurs. And related to plantar fasciitis is Achilles tendinopathy. Again, nearby, also another common indication, common type of heel pain. And then you have patellar tendinitis, just in front of the knee, you get tendinitis. And the last one is a greater trochanter pain syndrome. So these are 6 standard indications. And the most popular one will be the plantar fasciitis and the Achilles tendinopathy and tennis elbow. So these 3 will be the top. And that is where the money is, let's put it that way. So it's very popular, and you should use it before you resort to any surgical procedure. In fact, for all these conditions, plantar fasciitis, Achilles tendinopathy, and tennis elbow, I have not used surgery for the last many years, fortunately or unfortunately. Next, we come down to the bone pathologies. Now, bone pathologies are normally done by the orthopedic surgeon. We will not recommend bone pathologies to be done by non-orthopedic surgeons. And that include delayed fracture healing, non-union, stress fractures, avascular bone necrosis, mainly of the hip, of the femoral head, and sometimes osteochondritis dissecans. So these are all approved indications. And the most popular one, of course, is delayed union, non-union. You have to have a certain protocol for this kind of treatment. And the last, and also is quite common nowadays, is skin delayed or non-healing wounds. And for this, the most common is the diabetic foot ulcer, the DFUs, skin ulcers, and you can use it for other all delayed wounds and infected wounds also you can use it, and sometimes burn wounds also you can use. But for that skin, you need several treatments, not just one or two treatments. You need treatments for a week. We use focus once a week for say 6 weeks, or we use radial pressure wave, and you can use more often, 3 times a week. So these are the standard indications for shockwave therapy. The indications where it is not standard, but it is being also used for other things. We use it for a lot of foot and ankle tendinopathies. Other than the Achilles tendinopathy, you can use it for peroneal. You can use it for other tendinopathies in the foot. You can use it for pes anserinus tendinopathy, adductor tendinopathy in the hip, medial epicondylitis of the elbow, and rotator cuff tendinitis also. And the other common one is backache and neck pain. So neck pain is a myofascial syndrome where it is commonly used for pain relief. And for backache also, sometimes it can be used for pain relief in backache. And it is also being used quite often now for osteoarthritis, and there have been a lot of studies coming up. Comparison was use of shockwave for osteoarthritis compared to injection of PRP. I'm sure it is quite popular all over the world, also PRP and hyaluronic acid, and even some stem cell. And the studies have shown quite clearly that there is almost equal improvement in shockwave as compared to the other modalities of treatment. I think that's a very brief summary of shockwave. Most others you can get in the chapter in the book, and there are also many journals, like in the JBJS. It's a very good summary of it. Current concepts, I think it's 2 or 3 years ago. It was in the American Journal of Bone and Joint Surgery. It's got a good summary of it for orthopedics. We have used it for this kind of non-union. Of course, it would be better to be used when there is some callus there, hypertrophic bone. Hypertrophic non-union is of course better. But this sort of non-union, we can do it. But first of all, there must be some bone stability. So there must be some either an internal fixation or an external fixation. Number 2, there must not be any bone gap or very minimal. Normally, we do not advise more than a couple of millimeters of bone gap. If you have a big bone gap, your shockwave is not going to work. So if you have this, and even if there is some infection in the bone non-union, have shown good results. I would say the results of shockwave therapy for bone non-union is about 60 to 70% good results. That's non-surgical is very good. There is no bone grafting, no use of any additional materials. Okay. Just with this protocol where you have no bone gap and there's a good fixation. You can even use a plaster cast. You don't really need to talk about using internal, external fixation. You can use a plaster cast, but as long as there's no big gap, there must be just very small 1 or 2 millimeter gap. So there's a good chance of the bone union. If it doesn't work, you can still go to surgery. So you say a surgical procedure. We do not say that the shockwave can reduce the infection. You still have to go through the usual treatment of infection with surgery and long-term antibiotics according to the culture and sensitivity of the organism. Because in bone infection is always one of the biggest headaches of any orthopedic surgeon. We combine the shockwave actually with medication, normally non-steroidal anti-inflammatory drugs. And also we may send the patient for some physiotherapy after the shockwave. So its approach is it's multi-modality treatment of the patient. But I can tell you that shockwave is a very important component of this multi-modality treatment. And we have done lots of studies to show with and without shockwave that the improvement in the patient is significantly more with the shockwave than without the shockwave. Because physiotherapy and medication and rest and ice therapy, all basic treatment for musculoskeletal disorders. But with the addition of the shockwave, you find that things are faster and better and actually less expensive, because shockwave is not a very expensive treatment. I think sports medicine has grown tremendously in the last 30 years, I would say, and especially in countries where it is an important part of the lifestyle, like America, where it's a very small sportsmen, Europe, and now in China and Japan, sports medicine doctor, there are basically two kinds, in the sense one is a non-surgical sports medicine doctor, and the other one is the orthopedic surgeon who specializes in sports medicine. So he operates on it. And again, it's a teamwork, so you get both working together with the physical therapies, occupational therapies, sports therapies, and so on. So it is up there. It's one of the top subspecialties in orthopedics, and it is very popular for young orthopedic surgeons to go into sports medicine. I think lots of time it's difficult to choose your specialty. Sometimes it's more by chance. You may have been posted to a particular department, for example, anesthesia or surgery or obstetrics. Then you sort of you like the flow of it. You like the work, and you like what you do. So at the end of the day, to specialize in something, you need to like it. You need to have a passion for it. So it's best for you, if you don't like it, it's best for you to switch over to another specialty rather than proceed. At the end of it, you don't quite like it. Because now the specialty training is very long. If you're in the United Kingdom, to become a specialist is minimum of 7 years at least. 7 years. You have to go through your part 1 exam, your part 2 exam, part 3 exam, and then you need to do a fellowship. So it's a very long process. So you don't want to get caught up in something which at the end of the day you may not quite like. There are people who have dropped off actually after having finished their postgraduate training, and switched to something else. But it's best for you to make sure that you are in the right specialty. It depends on what you like. You like clinical work, non-clinical work. You like to, if you are in some specialties, you have to work literally 24 hours a day. So you have to think of that.